Welcome to the United Medical Institute, or UMI. In this video, we will share how UMI prepares students for real-world clinical practice and the values we instill in training future sonography professionals. United Medical Institute is accredited by the Distance Education Accrediting Commission, or DEAC. Our primary focus is on training aspiring sonographers. UMI offers diploma, Associate of Science, and Bachelor of Science degree programs in diagnostic medical sonography. Imagine a world where education integrates seamlessly with real-world clinical practice and community service from the very first day. This is a highlight of UMI's program. From the very first day in our diagnostic medical sonography program here at UMI, our students dive right into real-world patient care, guided every step by our dedicated clinical faculty. Imagine this. Within the first week, our students are already taking detailed medical histories, helping to translate complex medical information for patients, and filling out essential forms. But that's just the start. During the first 15 months of their program, which includes Clinical 1 and Clinical 2 Practicum courses, our students continue their academic and lab work while engaging in real-life clinical practice. By the end of this period, they have completed nearly 300 clinical hours, preparing them to progress into their specialized clinical placements. As they begin their final specialty clinical practicum, known as Clinical 3, our students are well prepared. They have mastered both the coursework and the necessary practical and patient care skills to ensure they excel in their advanced roles during this final stage of the program. But the journey doesn't end there. Imagine a world where education seamlessly integrates with community service. This is a daily reality at the United Medical Institute. From their very first day, UMI students not only immerse themselves in real-life clinical practices, but also dedicate their developing skills to serve in their communities. Through a unique model for the first year of students program, UMI partners with small ultrasound clinics that provide care to underserved communities. In California, we helped launch the nonprofit UMI Community Imaging Clinic, which offers free diagnostic ultrasound services. Similarly, in Arizona, our collaboration with TubaCare extends these critical services to those who are uninsured or underinsured. These partnerships do more than teach. They touch lives, embodying our commitment to hands-on practice and community service right from the start.
Hi, my name is Veronica, and I'm a student at the United Medical Institute in the ultrasound program. United Medical Institute has their own UMI clinic. It's a community imaging clinic that serves the population, those who either don't have insurance or are uninsured, and we offer a 100% free diagnostic imaging to them in ultrasound. The way that we're able to do this is students have the opportunity to volunteer with the help and guidance of the professors at the school who are teaching us the proper areas to be examined, what to look for, and this is providing a great experience to the patient as well as to the student, and is really paramount to our education.
Behind every ultrasound scan in which UMI students participate in the first year of their program, there's a story of learning, of growth, and of giving back. These stories are the heartbeat of the partnership.
This is my first time being seen here. I'm thankful for this place. I didn't have any medical insurance, and I had some concerning issues that needed to be addressed. I'm thankful that this place was available. They made me feel very comfortable. Thank you again.
In their first year, UMI students perform vital free ultrasound procedures for hundreds of patients, most of whom lack insurance or are underinsured. Let's now hear from a referring physician whose letter serves as a testament to the efforts of UMI students and faculty.
I am a volunteer clinician and preceptor at the Paul Home Asian Clinic, a clinic for the underserved Asian community. We provide care for many with chronic hepatitis B, the most common cause of liver cancer worldwide. Without access to these high-quality imaging studies, at no cost to the patient, many of our patients would have to forgo surveillance and thus be at high risk for liver cancer that is beyond cure at the time of detection. I strongly support the imaging program at UMI Clinic. They have an extremely valuable program. Without it, our patients would be at a considerable loss. Sincerely, Mary Patricia Pauley, Volunteer Clinical Professor, UC Davis.
Throughout the program, students' learning is regularly assessed and evaluated. The clinical evaluations are conducted by each student's immediate clinical faculty or clinical supervisor. Students receive their first clinical evaluation or Clinical 1 evaluation at the end of the first 20 weeks of the program or when they accumulate about 100 clinical hours. The second evaluation, or Clinical 2 evaluation, is conducted when the student completes their entire academic and laboratory coursework and accumulate 260 to 300 clinical hours. Students receive their third and final evaluation, or Clinical 3 evaluation, when they complete a cumulative 800 clinical hours for the program. Clinical evaluations are divided into 4 categories, each detailing specific skills and the expected competency levels at various phases of student training. Patient care and management, focusing on thorough patient intake and adherence to HIPAA regulations. Ultrasound competencies and scanning skills, covering everything from patient positioning to full scanning protocols, depending on the student's current level in the program. Foundational competencies and skills, emphasizing effective communication and a dedication to continuous learning. Professionalism and career readiness, highlighting the student's reliability, teamwork, respect, and integrity. In addition to their academic and clinical training, UMI students engage in various activities that enhance their academic and professional growth. Many participate in the UMI annual student scanning competition, Sonography. Additionally, UMI sonography students complete a comprehensive program-long capstone project. During this project, they produce reflection video essays and skill demonstration videos, among other assignments.
Hi there, my name's Taryn and I go to United Medical Institute in Central Heights, California. Today I'm going to be demonstrating how to scan the aorta, and we're going to be using the curvilinear probe in order to do that, as well as using the abdominal aorta setting on our machine. After putting on our gloves, we're going to grab our curvilinear probe and our gel. We're going to apply our gel to our probe. Of course, our mouth is always going to face the screen. We're going to warn our patient about potentially cold gel, and then we go ahead and apply. First thing we're going to do is we're going to hold our probe in sagittal plane. We're going to apply it right here, right below the xiphoid process, in order to obtain an image on our screen here that shows the aorta. Once we do that, we also can move down to follow the aorta into the abdomen. We're bifurcate into left and right. Iliac arteries. Once we find our bifurcation in the sagittal image, I'll go ahead and make sure I've got it right there. Go ahead and freeze it. And then of course we'd save our images. And first I'm going to annotate. I'm going to go ahead and unfreeze my computer because next I'm going to go ahead and do transfers. I'm going to go ahead and delete my annotation. I'm going to place this back on the application. And once again, right below the xiphoid process, we're going to look above the pancreas and look for the aorta. Now, this patient may please take a deep breath and hold. Great. Now, if you'll see on my screen, I've got a nice round hole here. I'm going to go ahead and pan it back until I get the best image I can because I will be measuring it. Let's go ahead and stop right about, about here. We're going to go ahead and measure from anterior to posterior, including the vessel walls. And I'm also going to be paying attention to these values right here. Of course, for the aorta, we're probably going to want a more round aorta than maybe more oval. Then I'll go ahead and label it one more time. We're going to do transverse aorta. This one happened to be proximal. Next I'm going to go ahead and unfreeze once again because we're going to work our way down. We just did proximal. Next we would do mid and then distal at the end. The thing we're looking for is to see if there's any abdominal aneurysm. Of course we don't want that, so that's what we're checking for. If anything's a bit bigger than 5 centimeters, is usually red flag. one of the last things we're going to do is we're going to go ahead and wipe down our probe. We're going to do a dry wipe first. And then we're going to get it with our antiseptic spray, clinic solution. Sometimes I do just a little bit more. Try to get through the corners and the corner. I go through my keyboard. And call it a day. Once the schedule for exam is all completed, of course you're going to take your towels and you're going to go ahead and clean off your patient. After all the gel is gone, ask them if they feel comfortable. Of course you're going to help them out and everything. And once the patient is out of the room, I like to go and then clean my probe and send over the pictures to the reading physician, which will then, of course, contact the patient with all the answers. We're going to go ahead, clean the bed, reset for our next patient or sonographer. After that, I'll dispose of my gloves in a proper manner, and then we're all done for the day.
You can explore more skill demonstrations from UMI students, along with more information about UMI and our programs by visiting our website at unitedmedicalinstitute.edu. Thank you for watching.